We are going live. And we're live. Hello, everybody.
Hey.
So, welcome, Chuck. Welcome, Corinne.
Hello, hello.
This is our send-off for International Nurses Week, which starts tomorrow.
Mm-hmm.
And we're just really stoked to have Corinne Wurden, registered nurse at Swedish Medical Center in Seattle, to be here to discuss with us. Chuck and I are Pulmonauts, also known as Breathwork instructors, and just people that are really interested in breathing. And we're here to learn about Corinne and what she's been going through, and to get into the world of nurses. You know, the first thing that I wanted to just say, and that Chuck and I both are here for, is just to say thank you.
Yeah, thank you very much.
To all the nurses, to you, Corinne, to everyone out there, just, you know, taking, I mean, it's a stressful job, and I don't even know the half of it or the quarter of it or any of that. It's just, you guys are on the front line, men and women are on the front line, taking care of people, and we've been through a pandemic. So yeah, I just want to acknowledge every single nurse, every single medical professional that's out there that's been taking care of us all throughout this entire last year and a half, and all of the time before that, and all of the time that you're going to be doing that. But thank you, Corinne, and thank you everyone else for being the amazing human beings that you are.
Yeah, thank you. It's been quite the year. Still going through the pandemic even now.
Yes.
With our numbers. So yeah, thank you for that. Appreciate it.
Yeah, you're welcome. And so just getting into it, I mean, you know, we're here, we're studying breathwork practices. We are using the breath in order to really manage stress, in order to be present in everything and to choose our desired state of being. You know, our questions really are just starting off with, you know, what's your world been like? How's it going?
Yeah. In terms of like the last year?
Yeah.
Yes.
In terms of the last year, sure. Let's focus on. Oh, let me. Chuck, can you also just introduce yourself for a minute?
Oh,
here?
hello.
Let's do that too, so that everybody knows what we're doing. Please, thank you.
I'm Chuck McGee III, respiratory specialist, breathwork instructor, whatever you want to call it. And you know, there's just so much that can be done that I think people just miss, and we want to bring that to help, you know, whoever's out there who needs it. Nurses for this week, because, you know, we need to shine a light on those medical professionals who are doing all that work. But this applies to anybody who is human and breathes. So that's just the group we're going for, is, you know, living, breathing human beings. So thanks for being one of them, and thanks for taking care of the living, breathing human beings that are having a bit of trouble.
Mm-hmm. Yeah.
So just back to you, Corinne, and you know, what has the world been like for you over this last year?
Yeah, and I'll add to, I work at Swedish, and my specific role there is I'm in the float pool with med-surg acute care patients. So I see there's like 13 different units that I can float to. And during the pandemic, they had just for support, like I would go to the ICU and help those nurses, even small things of like cleaning off all the equipment when they get out of the room, to make sure that was safe for them to use it in, because our supply was just so limited at the beginning of the pandemic that was just so scary. And our coworkers were getting sick because we didn't know properly what we needed to do, and our supplies was so limited. But yeah, that's where I work and what I helped through during the pandemic and worked. So yeah, last March, Seattle was hit, one of the first cities that was hit pretty hard with that. So, and then kind of like with like toilet paper, for example, like all that supplies just disappeared. So did in the hospital, like our masks, and then our hand sanitizer was gone amongst the other things. So that was one of the hardest parts, being unknowing what we were dealing with. I mean, I remember when we were all washing our groceries because we weren't sure how the virus stayed on our surfaces. So yeah, imagine that at hospital level, working with those sick patients.
Oh gosh, yeah.
And yeah, I almost cried when I saw our supplies was restocked in our room, because it was having to be locked in cupboards. And you would get one N95 mask for an entire week. And
Whoa.
it's supposed to be one-time use.
Wow.
So that was, yeah. We were all, yeah, I was teared up when I saw our supplies restocked where you could just go in and grab it.
Oh gosh.
That's amazing. So yeah, that was, springtime was really just so rough on everyone. And of course, my friend works at the emergency room in Harborview, and it's hard to even compare what we're going through. And we are both working with COVID patients, because she's just like direct front line, has no idea, when your coworkers are getting sick left and right, you're like, how do I keep myself safe? And then your family safe, of course, too, because that's something we really worry about as well.
Yeah.
And now that we're like today, for example, I mean, having all the supplies is really good. And of course, it's still like staffing shortages is a big deal for that. But it seems like we have it a little bit better honed in. Well, we for sure do. Yeah. And so that's a little bit better dealing with that. But the ramifications of a year of this, I think, is really going to take its toll on the profession.
Yeah, you mean just in the way of, not having as many people in the profession even, and dealing with burnout and things like that?
Exactly. Yeah. Burnout is so real. And I've heard recently there's a lot of people, like you hear of nurses like changing jobs and moving around, but there's been an increase of nurses like leaving the profession altogether. Which makes sense. I understand why.
For the past year, did they offer you any tools to help abate some of the stress they were loading on you? Did they even like address the fact that your mental health is being like drastically attacked?
They did actually. I went and I went through our emails to find, and this is like, they've had like at Swedish, of course, where I work, they have like a caregiver wellness section on our webpage, which is nice. And they offer, they have different, like, I took a screenshot of it, but a relaxation response, loving kindness meditation, guided imagery forest meditation, and it looks like a lot of guided imagery for like pain. So I've seen has popped up in the last month. So it's good to see at work they're offering this. I read all my emails, so I know about it, and I know they also have like counseling you can go to. I think like 10 sessions or something. So so that's good. I mean, it's like, I remember last year they like gave us an ice cream party or something, and the floor I was on, we were so mad. We're like, this is like the last thing I want right now. This is so insulting.
Let's get everyone close together, touching the same thing.
Yeah.
Oh
Corinne, is that Brody that keeps touching the microphone wire?
Yeah.
It's really loud. Oh. Brody's the dog.
Yeah.
It was that's what was making all that noise.
Oh, sorry.
Yeah, it's all good. Got it. Yeah. So it sounds like they're showing a few meditations and different guided imagery things with you all. I'm curious, is there any breath work in there, or have you seen any of that coming through?
No, I did look for breath work, and I did not see any breath work in there.
Got it.
Yeah.
Chuck has.
Damn it!
Chuck, you work in a chronic pain clinic, is that right?
A functional restorative therapy clinic. It's like 8 weeks of physical therapy to rehab chronic pain or injuries from on the job. And it's not just breath work. I'm part of a multi-modality training staff. We have psychologists, nutritionists, acupuncturists, cold lasers, a Feldenkrais specialist. She's kick-ass. Breath work, art therapy, and traditional physical therapy. So it combines all of those modalities together because it's never just one thing for long-term care. It's that full spectrum of holistic treatment, that marrying of the old modalities and the new modalities. So I'm really, really fortunate to be working with Dr. Victor Lee, who sees the effectiveness of the breath. So it was nice to talk to a doctor 3 years ago who's like, yeah, I want that. So we've treated 300 or 400 patients now over the past 3 years for chronic pain, applying breath with his whole pain modality. So it's amazing to be able to apply it in a health setting and see the effect pretty much right away.
Mm-hmm. That's one of the beautiful things about breath work, is that it's a somatic experience, and the minute you start practicing it, you start feeling the difference of whatever that intention is that you're working towards. And I'd love to right now, actually, Chuck, what's the most effective tool that you can think of right now that nurses can use on a daily basis in the workplace, out of the workplace, something simple, something powerful that can help them to manage that burnout and manage that stress?
It's
something to lead right now that we can go through with Corinne.
Sure, my absolute pleasure. That would be, so it's basically, if you can, while you're standing, because I know guys and girls are on your feet all day long and you don't have much of a chance to sit down. So this exercise takes 1 minute. If you can, practice it 5 times throughout your shift. And it's breathing in 4, out 6 through the nose. But before you do that, it's taking the time to just stand in proper posture. Mm-hmm. Stand with your shoulders relaxed, your head up, hold the wide view if you can, wiggle your fingers out to the sides. You can't see it because my screen's not thing, but my arms are extended. And you may look silly, but you wiggle your fingers out to the side of your peripheral vision, and it opens up your view and it helps relax the body. So once you open up your gaze, you drop your arms and relax them. And I'll lead us through 5 breaths. And we want to do this 5 times a day. So in, 2, 3, 4, out, 2, 3, 4, 5, 6, hold. In, 2, 3, 4, out, 2, 3, 4, 5, 6, hold. If you're really stressed, you can hum on the exhale. In, 2, 3, 4, out, 2, 3, 4, 5, 6, hold. In, 2, 3, 4, out, 2, 3, 4, 5, 6, hold. Last one. In, 2, 3, 4, out, 2, 3, 4, 5, 6. Now stretch. Let your breathing return to normal. Try and keep it in and out through the nose. And just taking that 1 minute, that exercise is 1 minute long, 5 times a day, standing in that proper posture offloads a tremendous amount of stress. So rather than backpacking it and carrying it with us all day long, and by the end of the day, getting hunched over and just being like, I was a bartender for 16 years, and I talked with a lot of nurses and doctors after their shift. So you may not need as many beers if you practice this exercise.
Yeah, I've realized when I'm stressed, alcohol is not the way to deal with the stress. For me, when I decide not to have a beer or wine, I'm like, oh, I feel a bit better.
Mm-hmm. Yeah.
Weird.
Well, and that's really the thing. So, Corinne, what did you feel from that, just that exercise?
Well, first of all, I love that the visual of like, yeah, but in this shift stressful day, I'm like going in on myself, thinking everything I did wrong, what could I've done better, how are my patients at the end of my 12-hour shift with them. And so I love that, of taking time to like really open up your chest and that breathing. And yeah, sometimes, I mean, some days taking 5 minutes it's hard to do, but other days you do have the opportunity to do that. It's, the beginning of your lunch break, for example, if you can get to that.
That's the key right there, is finding the times that you can put the ritual in, in between shift, literally when you go to the bathroom.
Yeah.
Like any time that you can find to just break up that constant packing of the stress, just like what Chuck was saying, breaks it up, and you arrive at your end of your day just a little bit less stressed out. And it's, so if you can find ways to put that into your schedule and just find little times for rituals. I mean, Chuck, you also do the one breath break.
Yeah,
and
that's another good one.
I'm going to combine this one with the top and the bottom exercise.
Let's do it. For the finding time, when we're stressed and when we're anxious, we are way more likely to make mistakes. So taking that 1 minute, because it's 5 minutes throughout your whole day, 1 minute at a time, taking that 1 minute to calm down and relax may save you 20 or 30 minutes, because you won't make that mistake you'd make if you're just rushed and hurried. And it's not so much about finding the time as making the time, because you're worth it and you deserve it.
Yeah. And I'm just thinking of days where I was just talking to my nursing friend about it. It's like, it's so busy and your mind is just moving a million miles a minute, because you're like, who do I need to see next? They now need this lab drawn because they had a temperature, and it just moves so fast. And then just taking a minute and would just reset my mind and get my heart rate down, and would just be, very necessary in those situations and really helpful.
But what's great about the exercise Chris is going to teach you is, if you don't have that minute and you have one moment.
Okay, I love that too. Yeah. Nurses will be all over that.
This is another really, really great one. And then also just for a moment, Chuck, before we go into this one, would you explain just for a second what the 4 in, 6 out is doing? What's the physiology and the biochemistry behind that's actually changing the state?
So we've got, as you know, Miss Corinne, we've got two sides to our autonomic nervous system: the sympathetic, which is fight, flight, go, 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 and parasympathetic, which is rest, relax, and regenerate. And the breath we're doing in 4, out 6 is, if your exhale is 1.5 times longer than your inhale, you are leaning into a parasympathetic state, that rest, relax, and regenerate. So taking that moment 5 times a day to just put the brakes on that go, go, go system helps lower your heart rate. If you're humming, especially if you're stressed and you're humming, you're increasing your nitric oxide saturation by 15 times in your body. It's a vasodilator, and nitric oxide is antiviral, antifungal, antibacterial. So by breathing in that and by humming, you're basically just like, okay, relaxing the body, helping, decrease that stress level, which will decrease overall body inflammation, and just keep you relaxed and ready to take on even more stress, because your job won't stop handing it to you.
Yeah. That's really cool to know. Like when we take out a patient line, like a central line or something out of their neck, we have them hum as we're pulling it out to help, to ensure they're breathing out and to prevent like air getting into the vein.
Oh, wow.
But that's cool that those other effects that it helps with as well, and calming, and because it's a stressful, thing to have something pulled out of your neck or your chest, for example. So
well, so that's with with these breathwork practices, if we, again, it's always through the nose is what we're always talking about for stress management and bringing yourself into parasympathetic. It's always nose breathing, in and out through the nose. And, if you don't have time, don't start your day off trying to do that 5 times a day. Start your day off trying to do that once.
That's true.
You don't need the goal of 5 yet. Just be like, I'm going to do it 1 time. That way you're not, making it hard on yourself. And then if you get another chance to do it again. Another chance to do it again. But really start easy on yourself, because you're rewiring, however long you've been doing this in the first place. So just look for one spot that you could do it in. see that it makes a difference, and then you'll start wanting to add on more too. So you'll get to the 5 eventually.
Yeah.
So as for the one breath break, and this is kind of combining two things. We're going to find the bottom of our breath, and we're going to find the top of our breath, and we're going to find the middle of our breath. So what's neutral, what's top capacity, what's bottom? And then there's the one, I also want to do the control pause. I think we could probably do the control pause in this too. So when you're stressed out, you're probably breathing through your mouth, probably breathing up high in your chest, and you're probably unconscious of the fact that you're doing that. So you have this additional stress coming out. And I can just like feel when Chuck's doing that, like my energy is like, God, okay, take a breath. So you're probably doing that unconsciously. And when you're unconsciously breathing through your mouth and you're unconsciously taking short upper chest breaths, you're creating more anxiety. If you are doing that consciously, if you're doing a conscious breath practice where you're choosing to, you're building energy. But if you're doing that unconsciously, you're creating anxiety. And your brain is not aligned with your body. And so that dissonance happens and you're just creating more anxiety, right? So that's the difference between bringing intention into your breath and doing it unconsciously and just being like where our habits currently are. And so this one is going to basically, I'm going to do a little twist on this, Chuck, and I'm going to see if it works. We'll find out. We're going to find the bottom of our breath, and we're going to rest there for a moment. And we're just going to let our thoughts flow until we need to take a breath. And what I've found is that when people are stressed out, we're breathing way more than what we need. Not what I've found, what the researchers have found. When we're stressed out, we're breathing more than we need to. We have off-gassed too much carbon dioxide. So our carbon dioxide levels are low, which is a vasodilator, which means that all of our veins are constricted, all of our system is constricted, and we're not properly able to transfer oxygen from the hemoglobin into our cells because the CO2 is what actually allows that. The acidity is what allows the oxygen to transfer into our cells. So we're in essence suffocating ourselves by breathing too much when we're stressed out. And so this practice is going to be a normal breath in, a breath out, and we're just going to rest there for as long as it takes. Let your mind go, let your thoughts flow, and just sit there for however many seconds that is. It may be 5, it may be 3, it may be 20, until you actually feel your body breathe for you. And that's going to reset your carbon dioxide levels and put you back into parasympathetic. Mm-hmm. We always tell people who are having a panic attack, take a deep breath. Don't tell them that. Tell them to breathe out and hold their breath at the bottom until they actually need to breathe again, and that'll short circuit that. That's
really great tips too, because whenever I have patients, lots of pain, for example, and maybe I've exhausted the amount of pain medicine or nausea medicine I can give them, or anti-nausea medication. Yeah, I always tell them to take deep breaths. So that's
So I'm gonna demonstrate what I see people in chronic pain, anxiety, asthma, and panic attacks doing when they breathe, and you can tell me if this is what you see at work. Is watch my chest. This is normal, but they go, I can't. So what they're doing unconsciously is called air stacking. They're taking many, many short breaths and filling their lungs to capacity. And it's not that they can't breathe, they just haven't exhaled. So when you tell someone who's full to breathe, they can't get it in. So by consciously deflating all of that and then applying that hold, it gives the body time to, okay. And you can help reset and tip that moment into their control rather than out of it.
Yeah. I love that. Yeah, thank you. I really love tools that don't involve medications to help my patients, because I think that'll really benefit them in the long term.
Exactly. Yeah. Yeah. And it's when I work with asthmatics that have been constantly, when I was a child, my circulation was shot. I was the whitest little kid ever because I had no color at all, because my veins literally were constantly constricted all the time. Mm-hmm. And so when I start using Oxygen Advantage, Patrick McEwen's protocols and things like that with asthmatics, doing that getting them in touch with, okay, here is where you're actually supposed to have your carbon dioxide level. They get dizzy, they get lightheaded, and they're like, whoa. And their hands start sweating, their feet start sweating. That circulation is coming back for the first time in years. And it's just like that lightheadedness comes from the brain is literally opening up and your amount of blood coming into your brain has increased. And I'm just sitting there going like, yes, do that more. Continue to do that. Relax and enjoy that sensation for a little while and get used to it again.
But that's a good thing, to that caveat, get used to it.
Yeah, you have to get used to it.
The more decisions we make, whether they're conscious or unconscious, reinforce that neurology within our brain. The more we make a choice, the more our body wants that choice to be made again, because it's that safe decision. It knows the outcome. So when we're working to retool these habits, we actively have to work against what the mind is telling us. Hey, I feel dizzy right now. I'm not comfortable with this situation. Well, that discomfort will pass, but we have to walk through that initial discomfort, which everyone's mind will give us when we start to change our habit.
Yeah.
So that discomfort is normal, that dizziness is normal, and that instinctive, I don't want to do this, is also normal. So that's the part where it's strange. We're like, but this will make you feel better. Nuh-uh.
Yeah.
I'm sure you've seen that.
All right, let's do there's two different ways I want to do this. The first one is pushing all the way out to the very bottom, which will reset your diaphragm and your posture and everything like that. The second way will be the control pause. So we're going to take a normal breath in, and then we're going to push our air all the way out to the very bottom as far as we can. And we're going to say 5, 4, 3, 2, 1, 5, 4, 3, 2, 1 until no sound comes out of our mouth. Then we're going to take a breath in through the nose, fill everything all the way up to the very top, sniff a few times to get that full all the way at the top. So we'll find the bottom, we'll find the top, and we're going to hang out at the top for a moment, and then we're just going to go and find what's that neutral point. So take a normal breath in through your nose, out through the nose. You can hum if you want, and start counting out. 5, 4, 3, 2, 1, 5, 4, 3, 2, 1. Really tension that diaphragm, tense your belly. You can lean forward a little bit if you want. Really push all that air as much as you can out. Small breath in through the nose. All the way up, slowly in. Open up your body, expand your body. Get to the very top, take a sniff in until you can't get any air in anymore. Now relax your shoulders, close your air, and just feel that. Relax your shoulders, relax your neck, move forward, move your body a little bit, holding that air inside, and just get used to that air inside your diaphragm. Feel that. You might get a little bit lightheaded. And then in a moment here, we'll hang out there for another couple seconds. And now just let it out gently, relaxed. Just to neutral. And so that neutral, you shouldn't be feeling any tension in your chest. You shouldn't be feeling anything. What that does is it'll reset your diaphragm, reset your posture, get you to that bottom of the breath to actually reopen up, and now you can take fuller breaths again.
Yeah.
And that's one of the ways of doing the one breath break, is just to explore, where's my bottom? How can I actually push that out? Crack your neck, whatever feels good, and just and you can do that as many times as you want during the day. It'll just reset the way that you're breathing.
Yeah, it feels really good.
Yeah.
And to that end, if you, I mean, everyone's wearing masks, but the unconscious habit to breathe through our mouth is doing us no favors at work. It is actively stressing the body out in a place where it doesn't need any help. And, you know, I've talked with a myriad of doctors and nurses, and it's, I should be breathing through my nose. I know the mechanics of a proper breath, but it's like, just, okay. No, not just okay, please. Make the switch.
So Chuck, what are the negative results of breathing through your mouth? And the one thing is, like, one place that you can apply this a lot is when you're talking. Are you on the inhale breathing in through your nose, or are you breathing through your mouth?
Mm-hmm.
That's one of the biggest things, is just bring your attention to that during the day and change your cadence, change whatever it is that you need. It literally changes the way your diaphragm holds air. Like if you picture a bagpipe, you need to have a different pressure inside your chest and body, more pressure, to be able to talk and breathe in through the nose rather than talk and breathe in through the mouth. So take it away, Chuck.
So, the nose conditions the air. That's what it's meant for. A lot of people think it's just this tiny thing on your face, but we've got our sinus cavity behind it. And as we breathe in through our nose, it filters and conditions the air. It adds or takes moisture away. It heats it up or cools it down so that when it hits our lungs, it's conditioned, and it's, you know, kind of a first stage of protecting. As you breathe in, your immune system scans it even before it hits your lungs. So your brain and body are more prepared for whatever pathogens you may have inhaled, and it's ready to fight it. We have nitric oxide, which is just one of the most beneficial gases we get, and we don't get as much of it when we breathe in through our mouth. And a lot of people think, oh, it's just in nose, out mouth. No, it's in nose, out nose, because as we exhale through our mouth, we lose 40% more moisture than if we exhale through our nose, because our nose will reclaim that moisture from our lungs. We're also off-gassing too much carbon dioxide, which causes our veins and arteries to constrict and ups our resting heart rate, our blood pressure, and our stress level. So by breathing in and out through the nose, we're conditioning the air, relaxing and leading into that space within our body. And when we breathe into our mouth, none of that happens. It's straight into the lungs. If the air is too hot or too cold, that's going to aggravate your lungs. A mouth breath is generally defined to the upper chest, so you're not getting as much diaphragmatic movement. And it doesn't get the blood flowing through your lungs as it really should. A lot of the blood will just sit in the lower lobes of the lungs. But when you take that deep diaphragmatic breath in, it gets the lungs to really circulate all of the blood in that area. So it's, you know, an upper chest breath leads to more stress in the jaw and neck. And breathing in through the mouth exacerbates that. Breathing in through the nose is generally more diaphragmatic. If you can get your chest opening and expanding, you can actually reduce the stress being put on your body by your job simply by breathing in and out through the nose. I say simply, but it is anything but.
It is. It's simple. It's just not easy to make the transition to actually doing
Yes.
it.
Yeah, Chuck, you answered I was going to ask how much more water we lose breathing out of our mouth opposed to our nose.
I think it's about 40%. I mean,
yeah,
if it could be 24 or 42. I'm dyslexic and I've had a head injury, so sometimes my brain switches the number around.
Mm-hmm.
So for all of you people out there who are really fact checking everything, I will admit right now that I could be wrong. And I think it's somewhere between like 24 and 40%, but I'm pretty certain right now. My brain's saying 40, but my brain lies to me all the time.
My brain's saying 42.
40. I like 40. I like 42 more. Just to answer
42 would be better. Yeah. Corinne. So first of all, I'd like to just say to people that are watching this, you know, we see your comments. If you have any questions as well, or questions for Corinne or for us, put them in the chat. That's why I keep looking over here. Julie says, thank you, Corinne, and all the medical professionals. And was talking about how some breathing exercises has helped her distract from severe pain in the middle of the night. And also, also helped when the inflammatory medications weren't fully effective. And the tips from Chris and Chuck really helped. Thank you, Julie. That's awesome. So if anybody watching has any questions, feel free to put it in the comments. Corinne, my other question for you is, what have you been using as the most effective stress management tool? And is there any of that like taught in school when you're getting into the profession? You know, I don't know anything about it. So is that covered?
Yeah, it's not really covered. And I was reflecting on that before we met, and I was like, well, for a lot of nurses, not everyone, like I got my degree at age 22 and started my career in nursing. So as a 22-year-old, you're immediately caring for the sick and dying, which I knew that I was getting into, but it's you're not really, which I think is why burnout is so real, because you're not given the tools to really succeed. For me, talking to my peers about what we go through, because we can all connect. You know, if you experience, we all experience something similar. So
Yeah.
connecting and having someone just be like, I know what you're going through, I see you, is really valuable to me, especially through the pandemic. I know I've loved the sessions I've dropped in for your breathing techniques. Is great. I have a meditation app that I've been using, is nice. After work, I'll try to use it
Nice.
sometimes, but other times I find it's too hard for me to get my mind to calm down.
Well,
And
that's one of the beautiful things about breath work, is that actually, if you put your intention, you can choose the right breathwork practice to either calm your mind down or increase your energy. And that's the thing about this too. You know, if you're feeling burnt out and you don't have energy, there are breathwork practices to stabilize yourself, to bring yourself back to that space where you actually can be energetic without burning yourself out more. So there's all these different practices, and with the Wim Hof method, that's like going to the gym for your vascular system and for your respiratory system. Really doing a workout that helps you to put yourself into those stressed out spaces hermetically, so that you're doing it in a short period of time and you actually increase what you're able to deal with. Mm-hmm. And you expand your range of stress that you're able to manage and to stay in that space where you're actually staying balanced. Then there's Patrick McEwen's Oxygen Advantage, which can help you to lower your chemosensitivity to carbon dioxide and be in a state of more openness, and to have your vascular system expanded more because you have more CO2 sitting in your system. So you're actually, go ahead, Chuck.
I was going to say, and with the application of the Wim Hof method and Oxygen Advantage, you reduce overall body inflammation. And if you're talking about the people who are most affected by COVID-19, it's those who are in a high stressed out state. Body inflammation is going crazy. And from a lot of the studies I've read, people who were less affected had less stress in their life, or better tools to manage stress, and didn't let it just compound and go crazy within their body. And, I can't say that applies to everybody. This is a panacea for everything. But all in all, reducing, the inflammation markers within the body also reduces how nasty the illness can be. And, just by, I think it's chronic inflammation is the number one cause of depression.
Wow.
And if you are breathing through your mouth, you are mildly inflamed all of the time. So a lot of the burnout may even be unconscious habits, because if you're not getting good rest, you're not recovering mentally and physically. And if no one said, hey, you shouldn't breathe through your mouth while you sleep, you should tape your mouth shut. I've had people go, that's extreme. I'm like, well, breathing through your mouth for 20 years is pretty damn extreme too. So the pretty gnarly things have to, and I don't even think it's crazy anymore. I used to, but as a nurse, if someone breaks their finger, you tape it or splint it so that they can't move it. If I break my arm, you'll cast it or splint it so I can't move it, improperly. If you're breathing through your mouth while you sleep at night, we tape it so you can't use it improperly. And that's my pitch for mouth tape.
And dovetailing on that, if you're breathing 8 hours a night through your mouth, unconsciously, you're just reinforcing the habit of breathing through your mouth all the time. Mm-hmm. So if you're able to start practicing unconsciously while you're sleeping, breathing through your nose, that's going to rewire your breathing habits during the day much faster and effectively than if you're only trying to change that while you're awake.
And it may take you a couple weeks to be able to sleep with the tape on your mouth for a full night.
Yeah.
And try an hour before bed, please. Don't be like, I'm going to try this now, and try and go to sleep. It's very hard. You've just introduced something new to your whole nervous system, and your body may stress out a little bit.
So this is really, really perfect. I want to give a shout out to Patrick McEwen.
Yes.
His new book, The Breathing Cure. He actually has post-COVID care protocols in there for people. So there's two things we'll go over. We're going to do that breath hold, that control pause that I mentioned earlier. The control pause is a way of measuring your chemosensitivity to carbon dioxide, and how, and Chuck, you'll have a better explanation than I have. It's basically like, how strong is your respiratory system right now? Where are you at? It's a function of it's called the blood oxygen level test.
The Bolt score, yeah.
Bolt score. It can also be called a control pause, whatever it is.
Mm-hmm.
And basically what you do is you take a normal breath in, normal breath out to neutral, like we found earlier, and you just rest there. And you rest there until you feel the first need to breathe. And that's not, you think you need to breathe. That's, you feel the first need to breathe. And when you should afterwards then breathe in, you should be able to breathe in normally, just like a normal breath. No difference at all. You're not trying to hold your breath for a long period of time. It's just, when is your body saying, hey, I need to breathe now? And then you can resume normal breathing. And so for a healthy individual, that should be about 20 to 25.
25 is
25
functional
seconds.
breathing.
It's functional breathing. And people coming out of post-COVID have 3 sometimes, which is, you're in really bad shape. So what he's created is some protocols for people that are sitting there literally cannot and are uncomfortable holding their breath for more than 3 seconds in between breaths, to really just have them start working on that diaphragm, to start building those muscles back up, to take it easy and to not push it. And if they're not able to walk across the room in the first place, they can do these exercises in bed.
Mm-hmm.
That's one of the biggest things about this.
Building the carbon dioxide, building those chemoreceptors to be more resistant to CO2. I've helped rehab about 6 people who've had COVID, and a lot of their symptoms become less and less and less the more resistant they become to CO2. In the beginning, they'll start at 2 or 3 seconds, but it'll take 2 or 3 months to get them up to 25 seconds again, sometimes longer. But once they get to that stage, it's no longer an arduous task to breathe. And if it's hard breathing, that means 20 to 25,000 breaths a day are under stress. And that's not going to do anything good for the healing of the body.
Yeah.
So, it's crazy.
Mm-hmm.
So let's do a control pause. And we'll just find out. Corinne, I'm curious where yours is at. I have a timer here, and we're just going to take a normal breath in, normal breath out, hold, and we'll see it when the first time it is that you need to breathe. So just go ahead, take a normal breath in, normal breath out to neutral, and hold. There you go. You were right at about 25.
Oh.
It was 24. and so in that, were you holding a little bit? Were you able to just take a normal, really super relaxed breath after that? Or did you feel like you really, really actually needed some air at that point? Were you trying to hold longer?
I probably could have taken probably around 18 to 20.
About 5 seconds. Yeah, I saw a little bit of a movement in your neck right at about 20. So I think that's probably where you're at. So
yeah.
When you feel that first little twinge, that little movement, wherever that is in your diaphragm, lower chest, belly, whatever that is, you're about 2 seconds before that.
Okay.
Because you're looking for the first feeling, not the first movement.
Mm-hmm.
And that'll be kind of like, and it takes a while to get used to it as well, because it's not something that we're used to.
Yeah.
So I would probably put you around the 18.
Yeah.
And that's great. Like, I don't even know, Chuck, if you know what the average is. The thing with all of this
13.
Is the average is 13. Yeah, There you go. So
10 to 13 seconds.
It's 13. And the issue with all of this stuff is that they study the averages, and they're like, okay, great, average this, average that. But what about, like, what are we supposed to have? What's functional? What's the real thing that we're supposed to get to?
The average breaths per day was at 18,000. And then they're like, oh, people are breathing 20 to 25,000 times a day. Rather than address the dysfunctional breathing that caused an increase of 2 to 7,000 breaths, they're like, yep, that's the new average. We don't know why. And, more people are depressed now. There's a high, cardiovascular disease and heart disease are the #1 killers across the world. And our breath rates have gone through the roof. This is directly connected. And doing the things like the Wim Hof method to exercise your cardiovascular system, finding the oxygen advantage of Buteyko methods for the rest of the day to optimize your breath. I mean, I think this should be taught in schools. Like,
totally.
This is how you breathe, and this is what I was never told in school, that my breathing could affect my emotions or my health. I wish.
We're the only animal that can consciously affect their breathing.
And we're also the only animal who forgets how to breathe correctly. Yeah. Every other animal, if they adopt substandard respiratory rates, get eaten or die. So there's that bright thing, I hope, right there.
So in this protocol, so yours is about 18, let's say. And so this can be found in The Breathing Cure on page 73 by Patrick McEwen. There's a whole story about a doctor and some of the clients that they're working with, and how this came up and how these protocols came about. And really it's something to be practicing about 10 minutes every hour for these patients. And he was working with a patient who was having a 3 Bolt score.
Oof.
If your control pause is at 3 seconds, with this practice, you don't want to be doing any holds for more than half of that Bolt score. So if you have 5, it's no more than 2.5. If it's 6, no more than 3. It's the half. And what we're going to do is we're going to practice slow breathing with lateral expansion and contraction of the lower ribs to improve alveolar ventilation. And so it's basically just a breathing practice where if you put your hands on your lower 2 ribs on the sides of your body, and we'll just practice first, just take a normal breath in and feel those ribs moving outwards. Be moving laterally out. And relax your shoulders also. It's kind of hard to do that, but relax your shoulders. I personally like taking my hands and going around this way, wrapping around me to give myself a hug. I wouldn't practice this with other people, but this just for right now so that you can keep your shoulders relaxed. And just feel those ribs moving out and moving back in. And we're going to inhale for a count of 3. So in for 3, in, 3, and out for 3. And then you can talk to the client and say, hey, are you comfortable with that? If you can, we'll go in for 5 seconds. In for 5, in, 2, 3, 4, 5, and out slowly for 5. Out, 2, 3, 4, 5. And really just breathing in and out for counts of 5. Feeling your lower ribs moving gently outwards as you breathe in, and inward as you breathe out. And for this practice, it's about 5 minutes, 5 times a day. And it's really, you're bringing in, you're creating that internal connection, the mind-body connection. You're calming your breath down. You're expanding and extending your breath. So if you have a Bolt score of 3, taking a breath in for 5 seconds and a breath out for 5 seconds is stretching it. You're pushing. You're really working on your diaphragm. And then the other part of the protocol is to breathe through your nose all the time. Day, night, wear the sleep tape, get them breathing through their nose so that they're not messing with their respiratory system by breathing through their mouth at night. It's just going to make it worse. And just, yeah. So we can share this afterwards, but it's the practices. There's a whole protocol in there. I recommend get the book, get the protocol, test it out. It's breathing. It's really calm. It's really relaxed. It's some place for them to start and to get their mind off of the pain and their mind off of what's going on as well.
If they're not willing to do anything, the most important thing I feel I can impress out of all of this is mouth taping. It is the single most effective tool to help retrain that unconscious breath, and you can do it while you're asleep.
Yeah.
And I tell this to every one of my clients, is if you're not going to listen to anything else I say, please tape your mouth.
Look like Deadpool. He had his mouth sewn shut.
Slightly less creepy.
Yeah.
I've been watching a lot of
Corinne, there's one more easy practice also that you can take with you when you're just walking around from one thing to another. Normal breath in, normal breath out. Walk 10 to 15 paces with your mouth closed and not breathing. That'll bring your carbon dioxide levels back up.
And it'll help sharpen the mind as well.
Mhm.
So for any of those times you're stressed out and you're like, I don't know what to do, exhale and hold your breath.
Yeah.
It's going to increase your vasodilation. It's going to get more blood to your brain. It's going to increase your mental acuity. Anytime you feel the brain fog, hold your breath.
Yeah.
On the exhale.
On the exhale. Actually, go do that right now. Go do that twice. Just stand up, take a normal breath in, take your breath out on the normal, to neutral, and then just go walk 10 to 15 paces. Do that twice and then come back.
Mhm.
We'll wait.
We'll wait. We have. Although I have to say, this is like the awesomest thing ever, and there's so much that can be applied.
I use that for
Yeah.
people with brain injuries.
Mm.
Because blood flow to the brain is one of the, they're usually mouth breathing unconsciously. So if they've got a brain injury, getting that extra blood flow to the brain, simply, close your mouth. That's not, you're not going to help yourself heal.
I like that one.
Yeah. Because you can do it in between anything. If you're walking from one room to the next room, or if you're in the elevator, whatever, just hold your breath for 10, 15 seconds and
Consciously, amazing exercise. Unconsciously, holy crap, ineffective.
Yes.
Because a lot of people, while under stress, our body naturally and instinctively tells us to hold our breath.
Yes.
Now, if you have substandard breathing and a crap resistance to carbon dioxide, when you're anxious, you're going to hold your breath. Then your CO2 level is going to hit that threshold and you're going to start panicking again. So those unconscious breath holds just compound the issue, but that conscious breath hold brings that relaxation.
So Chuck, what do you do when you find yourself unconsciously holding your breath? Because this happens to many people. They're just like, all of a sudden, they're just like, oh, I've been holding my breath. What do you do? Do you turn it into an intentional hold, or do you take a breath in?
I do the one breath break at that point.
Mm.
I'll find the top, I'll find the bottom. And generally, when people are holding their breath, they're doing this. They're either checking their email first thing in the morning, they're reading some bad news on the phone, and they just stop. And they don't even know they had that break, and their body's like, stop, too much. And at that point, if I find myself unconsciously holding my breath, I readjust, reset, and I reset my CO2 level, I reset my diaphragm. And then I will probably move into a couple of conscious breath holds just to increase that CO2 level. But I don't think, it's something that we just have to bring our consciousness and awareness to it.
Yeah.
And as you said, Chris, it's getting that connection between your mind and body, and knowing that no matter what's happening, your body is not actively trying to kill you.
Yes. Trust your body. It's there to heal you. It's there to take care of you. It can be hard to do that sometimes.
Oh man, especially if there's a disconnect.
Yeah. Yeah. All right, you guys. Well, it's been an hour, and I think we could probably keep doing this for another 5 hours if we wanted to. There's this is we did this today because on the 12th of May, which is the anniversary of Florence Nightingale's birthday and the last day of Nurses Week, we are offering a no-cost, open to everyone, hopefully invite all of the nurses that you know or other medical practitioners, whatever it is that you would want, to a no-cost breathwork session from 8 p.m. to 9 p.m. PST. And go ahead, Chuck.
We will record it.
We will definitely be recording this, so it'll be available to anyone. If you're on a shift that you can't make it, you'll have access to it afterwards. And we're going to discuss a few more things like what we discussed today. Do a full 5-round Wim Hof type breathwork session where Chuck will lead 2 rounds, I'll lead 2 rounds, and we'll actually have 1 round with no leading. which we found to be a really effective way for people to just connect with what do you need right now, so that you can all experience that, and then end with a bunch of Q&A.
So if you have any questions, comments, anything you'd like us to address, please ask. And if you're like, I don't know if it'll help somebody, what if it's just me? It's not just you.
It's definitely not just you.
It's not just you. Your question and that vulnerability you present will most assuredly help someone else.
Yeah. And if there's anybody in a position to want to create some protocols for nurses, education, to do with breath work, and to just do with what we do, we're totally open to creating more of these types of experiences, and to impart this knowledge as much as we possibly can. We just want people to use it. We think that the nursing community, the nurses community, I would say nursing, whatever, we know what we're talking about, can also impart that to all of their patients, and to people that they work with. So we see just an infinite amount of impact that can be made positively here. You got anything else for us, Corinne?
No, that was really fun.
All right.
One last wrap up thing. We have the 5 times a day, or one time when you first starting, 4 seconds in, 6 seconds out, with a 1 second pause at the bottom. 5 of those breaths. It takes about a minute. We had the holding your breath and going for walking 10, 15 paces and doing that 3 or 4 times in between wherever you can make that to bring your CO2 levels back up. We had the 1 breath break, and we had the finding the bottom, the top, the mid. And then the last one went over a little bit of a protocol for COVID-19 post-care. Again, that's in Patrick McEwen's book, The Breathing Cure, on page 72. Highly recommend. There is 500 pages to that book. The first 200 pages are all practices. The last 300 pages are all the research. So it's like required reading. So thank you, everyone. Thank you, Chuck, for being here. Thank you, Corinne, for joining. And thank you, everyone, for watching today, and all the people that watch it afterwards. Take care.
Thank you.